For over 75 years, Olmsted Medical Center has been dedicated to providing exceptional, patient-centered care across southeastern Minnesota. By bringing simplicity and compassion to the complexity of healthcare, Olmsted Medical Center empowers and engages our patients on their journeys to better health and better lives.
And we all know we should go for that physical or get that cholesterol checked, but we don't always. And sometimes it's too easy to take care of other people, or maybe you just don't have enough time and energy and there's other things on your list. But this is something that you need to bump up the list, and you should be selfish and take care of yourself. Better health and better lives. It sounds the same, but those are distinctly different. Better health refers to more healthcare factors. What's your blood pressure? How's your cholesterol? And that matters a lot, but we also care about the bigger picture. How are you doing with your family? How are you doing with your friends? How are you doing with social interactions? So these are things that don't always come out with healthcare conversations, but that are very important for your life as well.
Regular screening and routine preventive measures will assure early detection of any disease, which means a better outcome when we're dealing with any healthcare condition. Early detection of a disease will also give ample time for our patients to engage with their healthcare providers about the disease itself, getting to know what the disease means, getting to know your options. In OMC, we encourage our patients to be advocates of their own self. When they are educated, patients will be consenting, they will be voicing what they want to do moving forward, so they are empowered. This is what translates into a personalized healthcare plan.
In healthcare, to be courageous, you need to look at the definition. Being courageous means doing something, moving forward, and knowing that the outcome might not be the outcome that we want. Every day, we work very hard to empower our patients with the idea that it's okay to be courageous because we've got their back. We might come to a place that none of us wanted to be at, but we're going to be there with them, and we're going to help them get through whatever is going on in their life at that time. We work really closely at Olmsted Medical Center as a team. Our clinician team, our nursing team. In order for us to provide the level of care, we need to know each other. We need to be able to communicate. Our online options for patients to communicate with us makes a huge difference in our ability to get timely answers, timely results to our patients, and to answer any questions or concerns that they might have for us.
All right.
So I came in for a regular appointment with my primary care provider for an acute issue. A couple weeks later, I was able to get a mammogram. I was about 6 months overdue for my regular mammogram. The radiologist, after reviewing my scans, noted that there was a change that they wanted to look at further. And then they asked me to come in for an ultrasound. After the ultrasound, it confirmed that there was a likely carcinoma, and then they scheduled the biopsy to confirm. I knew at that moment, I was their focus. I was scared, but I felt reassured. I left here with my world turned upside down, but also with the reassurance that I could call them at any time that they were going to be there for me. I never felt alone. I think that you want to look for an organization that you know when you call, you can talk with somebody. And I think being able to talk with somebody about some of those what ifs is huge. A lot of times organizations don't want to share anything or talk with you unless they know for sure what that path is going to be. And I think that's one thing that was unique, is that they knew that I needed those answers, even though it wasn't set in stone what my path was going to be. But they helped me to see the different paths that I might have to take. They saved my life by reminding me to be a little bit selfish and take care of myself. And I think that's one thing that I've learned from this too, is you have to think about yourself. You can't always take care of other people, and you have to prioritize what you need to do.
I would recommend OMC wholeheartedly. Everything from their primary care to the specialty services here at the Women's Health Pavilion. They ask great questions. They are open to discussion. I never feel like I'm being told what to do. I always feel like, as we're talking about health-related things, that it's a dialogue. It's a conversation. And we come to the consensus together about what the best steps might be. So I've always just had a great experience. As women, we want to take care of other people, and we can't do that well if we don't take care of ourselves along the way. Nobody wants to think of themselves as a selfish person, but What are you doing for you? What are you doing to take care of yourself so that you can continue to take care of the others in your life? So to me, be selfish means being self-full, being aware and proactive in my own health so that I can be here to take care of others.
Our commitment to compassionate, patient-centered care ensures that every individual feels supported and empowered to take charge of their health. We believe that good health starts with great care. To learn more about Olmsted Medical Center, visit olmstedmedicalcenter.org.
They're the absolute center of your world. And everything you do for them. But when you walk through the doors at Olmsted Medical Center, we want you to do it for you. Because that's the only way you can keep doing everything you've always wanted to do for them. It's time to be a little more selfish. Good health starts with great care.